Thank you for having me here. It's a great privilege and a pleasure to be with you all tonight. I met some of the students a little earlier this evening and was just so impressed at the many ways that you yourselves are taking Catholic social teaching, explicitly or otherwise, out into all the disciplines in which you're involved, from community organizing to the health professions to prison ministry, so many different things. So my talk today is really about two different but related subjects. And I have to tell you right now that I think it's a little bit too long. However, when I get to 45 minutes or so, I'm just going to cut to the chase. So I'm not sure whether I'll actually get through all the second part. So the first part of it is really on U.S. healthcare reform, and the second part is on global healthcare. There's a connection between the two in Catholic teaching, so I think most of the general points I would make about the global situation will already be clear before I get very far into this paper. So as we all know, and as we're seeing now, and we have seen over the past 4 years, the last decade has really seen a mounting debate over healthcare reform in the United States. Although the debate is hardly resolved, the injustice of excluding now about 50 million people from access to the healthcare system in the wealthiest country in the world has now become a prominent feature of the national political agenda. Reform of the healthcare system requires the cooperative action of state and federal governments and legislation, civil society, and local organizations. It also requires the individual knowledge and commitment of every citizen and voter. The Catholic Church can show individuals, especially the members of the Church, but also others in our society, where our responsibilities lie, and it can encourage action. Anyone who works in or writes about Catholics and healthcare, and who has even a passing familiarity with Catholic social teaching, already knows that the system of healthcare in the United States today fails the test of justice, at least from a Catholic perspective. And now, according to the analyses of human dignity, of social justice, and the common good that have been evolving for over 100 years in the modern papal social encyclicals, healthcare is a basic right, and any good society will ensure that all its members have access to a decent level of healthcare and to health-related goods. This same framework of analysis informs the U.S. bishops' statements on the economy, on families, and on healthcare reform. As they already stated back in 1993, every person has a right to healthcare. This right flows from the sanctity of human life and the dignity that belongs to all human persons, who are made in the image of God. Healthcare is more than a commodity. It is a basic human right, an essential safeguard of human life and dignity. We believe our people's dignity should not depend on where they work, how much their parents earn, or where they live. So that was the bishops at the beginning of the first Clinton administration. The truth of the bishops' moral assertions is undeniable, and their moral call compelling. Yet 18 years later, it has still not been met in reality. The U.S. Census Bureau announced last September that in 2010, median household income declined and the poverty rate increased. The poverty rate in 2010, in fact, was the highest rate since 1993. In 2010, the number of people without health insurance coverage, usually because they were also without jobs, rose from 49 million in 2009 to almost 50 million in 2010. We all know, too, that many who do have health insurance lose it periodically, and many are denied coverage because for-profit insurers endeavor to cover only the healthy. Those who do have coverage have extremely high deductibles many times, or are denied coverage for specific services. Lack of coverage or inadequate coverage results in thousands of deaths a year, according to the prestigious Institute of Medicine of the National Academies. Harvard Medical School estimated the number at 45,000. The Institute of Medicine urged back in 2004 that the U.S. attain consistent, universal, equitable, and high-quality care for all people in this country by 2010. Yet in 2012, we are still the only country in the developed world, except for South Africa, that does not provide health care for all citizens. Now, this is despite the fact that we spend over 17% of the gross domestic product on health care, which is the largest percentage among all the developed countries, and it is double that of many other similar nations. Canada, for example, comes in second to us at half that percentage. Canada, of course, does have a national health care system. And even though the U.S. is number one in spending, contrary to the impression that many people have, we do not actually provide very good care. In fact, compared to other nations in the world, we are 39th in infant mortality rate, 43rd in premature adult female mortality, and 42nd in adult male mortality. There are also a lot of factors driving up the cost that have to do with our particular population and our national traditions to some extent. First of all, our population is aging. We're not alone in that among other countries of the world, but it's certainly a huge factor in our healthcare scenario. Americans also love to use technology. We also love lawyers, and malpractice insurance adds about 1% annually to healthcare costs. The cost of insurance itself is huge oftentimes. In fact, when people pay big premiums and then have low copays, it drives up unnecessary use. There are also high costs tied to prescription drugs and medical devices. We also see inefficiency and waste in our system, including Medicare fraud, which has been especially a target of federal investigations over the last 2 years. Another big problem in terms of cost is that our payment system is fee-for-service. Doctors get paid to do more procedures, typically, rather than on how well those procedures work and whether they are able to keep patients healthy. Without cost controls, of course, there is a proliferation of use and cost. Just back to the technology issue for 1 second. As I said, we here in the U.S. love it. For example, we do 4 times as many CAT scans as any other country, paying relatively little attention to their correlation with better health outcomes in specific types of situations. Another technology-related fact is that 80% of healthcare costs are in the last year of life, often again in high-tech medical facilities where people do not want to spend their final days in the first place, at least for most of us. I am myself at Boston College this semester teaching a bioethics course, and just earlier this week, that gave me an opportunity to go back over some of the Catholic documents on end-of-life care, such as the Vatican Declaration on Euthanasia from 1980, which is still a very wise and also flexible document. So our tradition on end-of-life care certainly allows people to forego disproportionate or extraordinary means, and it encourages the use of hospice rather than the high-tech tubes and machines. In fact, hospice began as a Christian movement and a ministry of Christian Catholic religious communities. Yet when the Obama administration proposed encouraging doctors to discuss humane and appropriate end-of-life care with their patients, it was accused of setting up death panels. So we can see that we have a very polarized situation, and one about which we Catholics should be very concerned. A survey of patients in 7 industrialized nations, including this one, showed a few years ago that Americans are actually becoming increasingly frustrated about the cost and the quality of care they receive. Researchers interviewed about 12,000 adults in Australia, Canada, Germany, the Netherlands, New Zealand, the UK, and the US. So they compared health care in both market-driven and government-managed health systems. Among all 7 nations, Americans were the most likely to go without care because of costs or to pay at least $1,000 out of pocket. Americans reported the most disorganized care, the highest costs, the highest rate of lab test errors, and the second highest rate of medical or medication errors. They were also most likely to see their healthcare system as dysfunctional. U.S. healthcare was given poor scores both by low-income uninsured patients and by higher-income patients. And as other research has shown, African Americans are always subjected to substandard care, including less access to indicated treatments, whether they are low income or whether they are middle-class professionals. On top of that, however, poverty during the current recession has increased much faster among African Americans and Hispanics than among whites. And if you are below the poverty line in this country, you can expect to live about 5 years less on average than your more affluent neighbors. A further point, one also related to poverty, and later, as I will show, to Catholic healthcare politics, is that the UN statistics show that the U.S. has the highest rate of abortions in the industrialized world. Countries with lower abortion rates all provide health care at reasonable cost. The Dutch and German abortion rate is 1/3 ours. The rate is Sweden is half, despite the ready availability of abortion. In fact, countries where abortion is legal, but the poverty level is worse, where abortion is illegal, but the poverty level is worse, have even higher rates of abortion than ours, such as Peru and Chile. Research in the U.S. has found that the abortion rate among women living below the poverty level is more than 4 times that of women above 300% of the poverty level. There was an abortion reduction study done at the time of the last presidential election by a Catholic group, the Catholic Alliance for the Common Good. And it studied all U.S. states from 1982 to 2000. And the study found that social and economic supports, such as public assistance to low-income families and benefits for pregnant women and mothers, have contributed significantly to reducing the number of abortions in the United States over the past 20 years. Now, having outlined the dismal facts of our situation, let's talk about healthcare reform. So probably most of you know that a Healthcare Reform Act was passed by Congress in March 2010 and signed by President Obama. The Reform Act is, of course, currently being contested. But what it proposed to do was to phase in several changes over several years. The legislation followed several decades of failed attempts by a string of Democratic presidents to reform health care. But I must say, reform was originally proposed back in the administration of Richard Nixon. The health care law that we have now seeks to extend insurance to more than 30 million people, which is not everyone. There are 50 million uninsured. This would cover, hopefully, 30 of them. It will do this primarily by expanding Medicaid and providing federal subsidies to help lower and middle-income Americans to buy private coverage. It will also create insurance exchanges, much as we already have here in the state of Massachusetts. We have already had a very similar reform here, thanks to Republican Governor Mitt Romney. Similarly, the new Reform Act is going to create insurance exchanges for those buying individual policies, and it will prohibit insurers from denying coverage on the basis of pre-existing conditions or from dropping people once they get sick and reach a certain level of expenditures. By giving states the discretion to specify essential benefits, the Obama administration sought to deflect one of the most powerful arguments made by its Republican critics. And that was that the federal government was imposing a rigid, bureaucrat-controlled health system on Americans. So we're going to have more state discretion to decide what will be recovered as health care. It is however, very far from true that what is proposed is a rigid, bureaucrat-controlled health system. It is not actually socialized medicine, a term that you hear batted around a lot. That's like they have in the UK, where the government administers both the health service and the payment system. And it's not even socialized insurance, which is what we would have if we had a single payer system, but the doctors operated independently. Rather, all that is being proposed here is greater regulation and protection of patient rights of what is basically still a market system. Now, in terms of healthcare reform, widening access is not the only issue. Another thing that is equally important and that has been highlighted more by the Republican Party is the necessity to control costs. And it's very true that this is crucial because otherwise expanding access will just be a non-workable proposition. To reduce the soaring cost of Medicare, the new Health Reform Act creates a panel of experts to limit government reimbursement to only those treatments shown to be effective, and also to create incentives for providers to bundle services together rather than just charge by the individual procedure. In addition, the new law requires a universal mandate to buy insurance so that risk and cost are shared by all. And that, of course, is also very much under attack right now, and the Supreme Court is even going to hear a case contesting the universal mandate. At the end of the day, the new law is going to be expensive. It will cost about $938 billion over 10 years, according to the Congressional Budget Office, which has also estimated that it will in fact reduce the federal deficit by $138 billion over a decade. Now, how should we in the US look at the healthcare situation from a Catholic perspective? And here, just to give you a little preview of what I'm going to do, first tell you about Catholic tradition and Catholic social teaching, just very briefly, and how that relates to healthcare. And then I'm also going to comment on some of the documents that have come out of the church. So one of the things would be a voting document called Faithful Citizenship, and how, put out by our bishops, and how that lines up healthcare with other priorities. I'm then going to talk just a little bit about how Catholics actually seem to be reacting to all of this based on voter data. And then I'm going to compare the political advocacy of the U.S. bishops around health-related issues to that of the Catholic Health Association. And to just lay my cards on the table, while I'm not here to find fault with specific elements of the teaching of the Catholic bishops, I think that their priorities are lopsided and misguided. The Catholic Health Association, on the other hand, in terms of its priorities and its advocacy, I believe represents better what Catholic social teaching would lead us to. Okay, so how do we look at the U.S. healthcare situation from a Catholic perspective? A main resource, of course, is Catholic social teaching, which centers on the concepts of the dignity of the person and the common good. The modern papal social encyclicals began at the end of the 19th century, and they affirm the dignity of every individual person, but they also situate the person firmly within the good of society as a whole, in which everyone has a right to participate, and to which we all have a responsibility to contribute. Hence, we have both civil and political rights, such as free speech and a right to vote, and material and social rights, such as rights to food, shelter, clothing, education, a fair wage, and health care. These rights enable us to fulfill our responsibilities. Since the Second Vatican Council, the Catholic Church has also placed the common good in the perspective of the global community and refers to the universal common good, which will take us later, I hope, into the global health situation. Now, immediately, however, how does this perspective inform our approach to the reform of the U.S. system? To put it concisely, healthcare reform that serves the dignity and the dignity of all and the common good must include three priorities to which I have already alluded. One, equitable access for all, at least to basic resources. Two, cost control, so it's a viable system. And three, quality, that is, a wise use of money and a wise stewardship of resources. Healthcare must enhance the dignity of all human lives, including the poor, the elderly, the unborn, and immigrants, whether legal or illegal. Everyone's basic needs must be met so that all can live with dignity and make their own contribution. To meet the basic health needs of all, an unrestrained profit motive in the healthcare business must be curbed, as must the overuse of expensive and ineffective technologies by the few who either have money or insurance. In preparation for the 2008 national election, so that was in the McCain versus Obama campaign, the U.S. bishops issued a document called Faithful Citizenship. That same document has now been reissued for the 2012 elections with a new introduction, which I will talk about later. Right now, I'm just going to tell you about the main content, particularly as it bears on healthcare. And the key point here is that while the Catholic Church is often seen as a single-issue advocate of only so-called pro-life issues, such as against abortion, against euthanasia, against stem cell research, and embryo research, in fact, the Catholic spectrum of important issues, while it includes those, is much broader. And Faithful Citizenship makes that clear. That document has been reissued for the current election cycle. The document says, affordable and accessible health care is an essential safeguard of human life and a fundamental human right. With an estimated 47 million Americans, which is what the number was in 2008, lacking health coverage, it is also an urgent national priority. Reform of the nation's healthcare system needs to be rooted in values that respect human dignity, protect human life, and meet the needs of the poor and uninsured, especially born and unborn children, pregnant women, immigrants, and other vulnerable populations. What stands out in this little paragraph as remarkable or notable? First of all, healthcare is a national priority. Deserving of special regard are born and unborn children and pregnant women. This represents Catholicism's pro-life values. But equally important are the poor, immigrants, and vulnerable populations. The bishops continue, the right to life implies and is linked to other human rights, to the basic goods that every human person needs to live and thrive. All the life issues are connected. The moral imperative to respond to the needs of our neighbors, basic needs such as food, shelter, health care, education, and meaningful work, is universally binding on our consciences. Racism and other unjust discrimination, the use of the death penalty, resorting to unjust war, the use of torture, war crimes, the failure to respond to those who are suffering from hunger or a lack of health care, or an unjust immigration policy are identified by the bishops as all serious moral issues that challenge our consciences and that also require action. These are not optional concerns, that is their terminology, which can be dismissed. On these points, the bishops cite both John Paul II and John the 23rd, as well as the Catechism of the Catholic Church. In addition, I would note, they cite John Paul II on abortion and public policy. John Paul II advised that legal and policy advocacy on abortion must follow what he called the art of the possible, not a single prescribed solution, such as the recriminalization of abortion. Now, how are Catholics, the voters, Catholic voters, responding to the array of issues in faithful citizenship? Well, it seems that Catholics, according to voter data, are not actually voting primarily on the so-called social issues or moral issues or values issues like abortion or gay marriage or stem cell research, whether for or against those things. What is most important to voters, including Catholics, and this probably won't surprise you, is the economy and jobs. And so there has been voter and election polling that's gone on ever since 2004 by the Pew Forum and Zogby. For instance, now there's a newer organization called the Public Religion Research Institute, which has some really interesting data on voters, religious voters, Catholic and otherwise. But to just take one really recent thing, so just last month, January 2012, the Pew Forum released data showing that 80% of voters across the religious and ideological spectrum say jobs and the economy are the #1 priority. Now here, while we keep in mind the Catholic social teaching priority of an option for the poor, I think we could reasonably infer that these religious voters, when they're voting on the economy, are not thinking primarily of those who are least well off, but really of their own economic futures, as we all are. I think that's very understandable, particularly if you are one of the least well off. I think a job for us as Catholics and a job for the teachers of the church is, however, to continue to make the case that while it is moral and legitimate to strive for a better future for ourselves and our children, we must not forget to be in solidarity with those who have less power and maybe even further on the margins than we are. In this regard, some data that was actually just released last fall by CARA, C-A-R-A, which is a research institute at Catholic University, seems to support the inference that Catholics in voting on the economy are not motivated in any particularly central way by the option for the poor. So the CARA study, what it was really trying to do is to look at Catholic identity. And it used a whole lot of different things like mass attendance, sacraments, and then questions about what you regard as most important to your Catholic identity or to Catholic identity in general. And one of their findings is that 80% of Catholics say helping the poor is a very important or somewhat important aspect of Catholic identity. In fact, of those 80%, actually 50% of Catholics said it's very important. However, if you read a little further in statistics, you also find out that the same study found that 60% of Catholics say you can be a good Catholic without actually doing anything to help the poor. So, what you say to agree, that you agree with and that you affirm may be different than what you do when you walk out the door or go into the voting booth. And as I said, I think this is really where we have our work cut out for us. The economy, including affordable health care access, is an important, or even the #1 election issue in 2012. But from a Catholic perspective, it's not just a priority for me or even for my country, the United States. We all must learn to be in solidarity with those who are the least well off, even when we're in a position that's not so great ourselves. And we must also extend this commitment and solidarity to the global human family, committing to positive action for structural change. Okay, now having laid that manifesto out, I'm going to see how well the Catholic bishops are doing right now and then look at the Catholic Health Association. So, I've done this periodically over the years, and, I guess I'm sorry to say that I've always been able to make the same argument about the priorities of these two entities, but I spent a lot of time yesterday just looking at their websites to get something that's, really current. The first thing that I'll tell you about from the bishop's website goes back to what I was just discussing a minute ago, and that's the document Faithful Citizenship, which has been reissued as a voter guide. And the new introduction that has been added seems to segregate and prioritize that spectrum of issues that they were talking about in 2008 in a somewhat different way. So it doesn't contradict or take back or revise the content of the 2008 document, but at the beginning of it, we now have an introduction which says that in particular, there are several key problems that they just want to call our attention to. And they say that some of these involve opposition to intrinsic evils, while others just raise serious moral questions. So you seem to get the impression that they're not quite as much on a par as they seem to be back in 2008. And not surprisingly, there are 6 priorities that are set out. 3 of them, well, the first 3 are sort of maybe representative of what the image of Catholic priorities is, and the second 3, I think, represent what has often been called our best kept secret, that is Catholic social teaching. Okay, so the first 3 to which your attention is immediately drawn are first, the continuing destruction of unborn children through abortion. Secondly, renewed efforts to force Catholic ministries to violate their conscience, and I'll explain about that a little bit more in just one second, but it has to do with birth control. And then thirdly, intensifying efforts to redefine marriage in a way that would undermine its definition as the union of one man and one woman. So in other words, gay civil unions and gay marriage. And then the second set of 3 priorities is the economic crisis. Of course, this is the issue on which, to which most of the current Pope's encyclicals and recent writings have been devoted. Secondly, the failure to repair a broken immigration system. And thirdly, wars, terror, and violence, and morally questionable uses of force, military force. Okay. So now, I said I would talk a little bit more about the question of religious liberty, which the new Introduction to Faithful Citizenship puts second in its list of priorities. So this is not a test in the sense of, proving how well read and so on you are. I'm testing a hypothesis about how broadly this issue is known. So I just want to know, who of you has heard of or knows about a recent ruling of the U.S. Department of Health and Human Services against which the U.S. bishops are vociferously reacting in terms of religious liberty? Okay, so the faculty has heard, and some maybe of the students, but for most of you, this has just passed by. And this is a problem that I have. So I'll explain this more, but one of the things that's really driving me and driving this presentation is that I'm really afraid that the Catholic bishops and those who are debating with them, aided and abetted by the mainstream media who love to cover this, are really addressing things that are not on the plate of most of the voters, that most of the voters are not following, and that's not going to be on their mind when they walk into the voting booth. So by being distracted by these things, we are missing a huge opportunity to prioritize the things that our tradition has in terms of healthcare reform and the economy and immigration and war and peace and so on. But anyway, let me just give you the nutshell description of what it is that happened. So recently, the Department of Health and Human Services issued a ruling. Actually, it's two rulings. They won't be implemented for a year, so it could still be contested. But it's sort of 2 parts. And one was that, well, first of all, the new Affordable Health Care Act says that insurance programs have to provide preventive services free of charge, that is with no copay. Not free of charge, you pay for your insurance, but there's no copay. And so the Department of Health and Human Services recently mandated that that has to include contraception. And the Catholic bishops reacted against that and said Catholic institutions shouldn't have to be required to provide contraception in the health care plans they provide for their employees. And they argued for an exemption based on religious liberty. And the Department of Health and Human Services thought about that and then made another ruling. And it said that you can't have that exemption unless you're an organization that employs all Catholic employees and also serves only or a majority of a Catholic population. Okay, so there were really 2 things that are on the table. One is providing contraceptive services, and the other is what's defined as a religious organization. So the Catholic bishops are rejecting both of these things and really campaigning Number one, that they should be regarded, not they, the bishops, I mean, that's not in question, but say Catholic hospitals, Catholic universities, Holy Cross, for example, Boston College. I don't know what you have here, but at Boston College, we have as an option access to a really good healthcare system called Harvard Pilgrim Healthcare. We've had it ever since I went to teach there, over 30 years ago. And as far as I know, it provides all medical care that's regarded as standard practice. It's never really been raised as an issue. I mean, Catholics will use what they think it morally responsible to use, but I think the university provides this for us under the aegis of simply providing good basic health care to its employees. And I haven't also heard this discussed on the BC campus, so it's sort of similarly to here. But anyway, the Catholic bishops are objecting to this as a requirement, okay? Now, my main issue here is not so much whether or not they have a right to object. My main issue is that this has totally taken over their website. There are also bishops making statements about this constantly in the press. The National Bishops' Conference has sent out bulletin inserts to Catholic parishes. Many Catholic parishes in the Diocese of New Orleans, I think that the bishop actually mandated that they had to talk about this in the parishes last Sunday. So there's a lot of action and advocacy going on around this issue, this Health and Human Services ruling. It's telling, for example, that the USCCB, that is the bishops, that's the bishops' organization, put out 17 press releases in January dealing with religious liberty. None of their press releases dealt with poverty, despite the fact that January had been declared Poverty Awareness Month by the USCCB itself. And when I went to their website yesterday, I saw a whole lot of things, a whole lot of links, a lot of information. I'll just read you a few of the points that I saw there. It called attention to and gave a link to a letter that was published in the New York Times and the Washington Post just before Christmas, signed by 400 Catholic leaders calling on Congress to reverse this decision. They also provided a link and sort of a template for individuals accessing their website to actually write to Congress and urge support for the rights of conscience. They exhorted people who went to their website to share that particular page with other people so everyone can get informed and take action too. They even gave access to social media and email options and a video of Archbishop Dolan, Cardinal Designate Dolan, who's the head of the USCCB, of his video on this topic. They also provided links to news releases that they have released recently. Just the titles of some of them are indicative. For example, bishops decry HHS rule. Again, Cardinal Designate Dolan speaks out against HHS rule. And finally, U.S. bishops vow to fight HHS edict. Okay, now from all of this, it would take you quite a while to figure out that actually somewhere buried in the website, you can find the 1993 letter on healthcare reform. You can also find a policy statement that they made in recent years on the right of all legal immigrants to healthcare. One would ask if it's a right, why isn't it everyone? Why just legal immigrants? But in any case, they're advocating for immigrant access to health care. A last thing that I'll give you is that they have a link to quotes from church documents about issues of human life, justice, and peace. So I went there, I thought, well, good, now we'll find some Catholic social teaching. Of course, the first and by far the longest section is called Pro-Life, which has 17 quotes from various papal and episcopal documents. Of those 17, 10 specifically mention abortion. The next section is on faithful citizenship itself. There are only 4 points there, and the lead off point is on abortion. Then there were shorter sections on global poverty, on foreign aid, and on debt reduction and just trade, and each of those had just 2 points. So it's not so much that I don't see all of these things as part of Catholic teaching, But I think some of the issues that come further down on the list deserve a bit more time than they're getting, and maybe more of an equal treatment. Okay, so now let's move along to the Catholic Health Association. And I can see indeed that my time is getting short, so we may not get too far into the global issues. Maybe I'll just make a few parting shots. But anyway, if you turn to the Catholic Health Association, again, you definitely see advocacy for pregnant women and for children, and support for, human beings across the life spectrum, born and unborn. But you also learn that before the reform law was passed, while healthcare reform was still under discussion and negotiation, the Catholic Health Association proposed its own vision for U.S. healthcare, in which it called for public policy that would enhance the health status of all communities. When the reform legislation was passed, it issued this statement: "The Patient Protection and Affordable Care Act became law on March 23, 2010. CHA and the Catholic Health Ministry have been working for decades on behalf of health reform that protects life and expands coverage to the greatest number of people in our country. The Affordable Care Act is not perfect, but it represents a good start toward providing access to everyone." In addition, publications of the Catholic Health Association, they have two in particular, Catholic Health World and Health Progress, have constantly published articles on access to health care and different community, state, federal, and faith-based efforts to provide that. For example, in a recent issue last fall, they had a story on the fact that the Affordable Care Act is funding school-based health centers, especially for children in low-income or rural areas, and that it has given, the federal government has given $95 million in grants for these school-based health clinics, many of them supported by Catholic hospitals. So Catholic hospitals are definitely getting support to help expand the mission that they feel is so important. An article in Health Progress, however, does note that last May, the U.S. House of Representatives voted to rescind the funding for school-based health centers as part of a broader effort to repeal, scale back, or defund health reform. And the article concludes, "That makes all the more important our continued advocacy, public education, and awareness efforts. To help change the narrative around health reform, CHA has been collecting stories of real people who have been helped and healed because of the Affordable Care Act." And then it says that you can watch the video vignettes on YouTube under Health Reform Works. So they also have a political advocacy campaign, but its priorities are different than the ones that we find on the USCCB website. Okay, so now let's see. All right, I'm going to, can I just take like maybe 7 more minutes or something? I don't want to torture you here since you were so nice to come at 7:30. But I just want to say a few things about global health needs and the common good. Because one of my points is that even within the United States, we need to get our priorities more in line with what the tradition of Catholic teaching has held, including the bishop's own document, Faithful Citizenship. And while all that stuff is still on the bishop's website, the priorities get skewed, and so our attention gets skewed as well. And yet I don't necessarily believe the voters are really listening to that. Instead, they're so worried about the economy. So a great opportunity is being missed to really put out a message where it needs to be and will be heard. Part of that, though, has to be the global arena. Okay, we are suffering here in the U.S. I have 5 young adult children. All 5 of them are either underemployed or unemployed. And I am providing individual health care. I'm fortunate that both my husband and I are employed and we can afford it. But I am paying $400 plus a month for the health care of each of these 5 children. Okay, so this is a problem. I would like my children to have jobs, I would like them to have health care, and I would like people whose parents can't afford that to also be able to have access. At the same time, when we look around the world, it's not difficult to realize that situations are much more drastic. And we talk about overuse of technology and so on. I mean, that's not even in the universe of most of the people in the developing world. The suffering and death that's caused by the so-called diseases of the poor make a claim on all of us. And the most frequently mentioned, of course, are AIDS, TB, and malaria. Also, the other leading causes of death, in addition to AIDS, are respiratory infections, diarrhea, and again, malaria, especially for children. The risk for women dying in childbirth is 250 times greater for women in poor countries than in rich ones, with more than 500,000 women a year dying from complications of pregnancy. And so with that in mind, just let me read you a few more statistics. If you hear these, I think my point will be more than made. And these were statistics that came out several years ago from the UN Development Program in one of their human development reports. Okay, so the amount of money needed each year to provide reproductive health care for all women in developing countries would be $12 billion. Sounds like a lot. The amount of money spent annually on perfumes in Europe and the United States is $12 billion. The amount of money needed each year to provide water and sanitation for everyone in developing nations would be $9 billion. The amount of money spent annually on cosmetics in the United States is $8 billion. And finally, the amount of money needed to provide basic health and nutrition universally in the developing world, so basic health universally in the developing world, as well as food security, would be $13 billion. Sounds like a lot. But the amount of money spent each year on pet food in Europe and the United States is $17 billion. So we need to look broader, more broadly, obviously, than we are sometimes inclined to do. So just a couple of papal quotations to take our focus back, to the center of the teaching here. Pope John Paul warned in 2003 that there is, quote, a very serious and unacceptable gap that separates the developing world from the developed in terms of the capacity to develop biomedical research for the benefit of healthcare assistance and to assist peoples afflicted by chronic poverty and dire epidemics. It is essential to realize that the lack of healthcare structures commits an injustice and fuels a long-term threat for the globalized world. Again, in 2008, Benedict XVI gave a speech at the UN in which he said that an important public dimension of religion is promoting health and education. In his World Day of Peace message in 2009, he classified AIDS and other diseases of the poor as justice issues. In his 2009 encyclical, Caritas in Veritate, he carried through Paul VI's call for international development, including an end to global poverty, hunger, and disease. And finally, in 2008, at the end of 2008, after our presidential election, there was released a document from the Vatican called Dignitatis Personae, which is it's on right to life issues, but primarily about the embryo. And it reinforces the positions that would be taken by the U.S. Catholic bishops. Interestingly, though, two things about it. First, it was actually signed by the Pope in September, but it wasn't released until after the election, presumably because the Vatican didn't want this to become a pawn in the battle for and against Obama. In addition, that document, although it was primarily on embryos and fetuses, included at the beginning and the end, in Section 2 and Section 22, a plea for greater global health access and justice. So the Pope, at least, is not focusing only on one set of issues. I think I should probably conclude at this point. I have some other examples of global health efforts, but I think that that will round it off and maybe give a little bit of time for discussion. I know that there are people here from different disciplines and students and no doubt faculty who have experience in many areas related to this. So it's not just to ask questions, but if you have points of view, if you have other information, if you've been involved in different kinds of work, we would all benefit from hearing about that. So I invite you into the conversation.